Hi, I'm Joe Fifer, President and CEO of HFMA. Welcome back to our web video series. This month, I'm talking about the Surgeon General's new report on addiction in America. Yes, it is a new topic for us, and it's a topic that hits very close to home for me. As many of you know, I'm a person in recovery. It is a fact I do not broadcast, nor do I hide it. I've been sober for over 19 years, due in no small part to my wife Katie, several loving family members, and my faith, which keeps me grounded. I'm one of the lucky ones, blessed if you will, because my recovery has enabled me to become who I am today. I'm also a board member of a not-for-profit organization called Facing Addiction, which works to unify the voices of millions of Americans and their families who are directly impacted by addiction. So clearly, I have a personal interest in this topic. But it's not just a personal issue, it's a national issue. According to data from Facing Addiction, 22 million people in the United States suffer from addiction today, with another 23 million in recovery. 1 in 3 households are directly impacted by addiction. The impact of addiction on our healthcare system is huge. Our health plans have been footing the bill for the addiction epidemic for years. Consider this. About 70% of the 22 million people suffering from addiction today are employed, and most of them have private insurance. That's more than 15 million people running up bills and driving up health insurance premiums as a result of addiction. When I was at Spectrum Health, I worked with an emergency medicine physician by the name of Corey Waller. Dr. Waller studied frequent visitors to the ED. He found that many frequent flyers suffered from mental health issues, including substance abuse. These frequent flyers didn't have adequate primary care. They didn't have a treatment plan for their underlying substance use. So they went to the ED over and over again, running up millions of dollars in costs to the system in a matter of months. And that was just one health system. Dr. Waller studied the impact of creating a special primary care setting and dramatically reduced the number of ED visits and overall healthcare costs for these patients. In many cases, he helped them face their own addiction. The impact of addiction on healthcare costs goes beyond the ED frequent flyers and beyond substance abuse treatment itself. Down the road, substance abuse contributes to a variety of chronic conditions. Most of you know the rule of thumb that 5% of health plan members generate 50% of medical claim costs. What you may not realize is that the vast majority of these superutilizers have chronic conditions. According to the Centers for Disease Control and Prevention, treating people with chronic conditions accounts for a whopping 86% of our nation's healthcare costs. 86%. So connect the dots. As risk sharing works its way through the industry's financial infrastructure, the costs of addiction and the chronic conditions associated with addiction are now being shared with the provider community. The addiction issue is becoming a financial issue for all healthcare stakeholders. That's a financial reason why the Surgeon General's report is so timely. Exactly. In the preface to the Surgeon General's report, Secretary Burwell wrote that substance abuse is a major public health challenge and it must be a priority for our nation to address. I couldn't agree more. It's time to put to bed the ignorance about substance abuse in our society. Addiction is a disease, not unlike others that we treat with compassion, such as cancer or heart disease. It's time to realize, as the Surgeon General states in his report, that there is a neurobiological basis for substance use disorders with potential for both recovery and recurrence. It's time to realize that while opioid abuse is the current hot topic, alcohol abuse has been ravaging our country for years. It's time to better ourselves and our healthcare system. It's time to face addiction. Thanks for watching. I'll see you next month.